Okay, today we will see about practicals of passive movement. Okay, so just summarize about theoretical about passive movements. What is a passive movement? So passive movement is movement, therapeutic movement.
Movement which is given external force by therapist.
Okay, so எப்போ passive movement தரணும்?
Patient வந்து unable to reach the range of motion.
So patient unable to reach range of motion or unable to do movement. So movement பண்ண முடியலங்கிறப்ப தான் we will give passive movement. So for which type of conditions we will give passive movement? Paralysis. Okay. So paralysis in which diseases it results in paralysis? Neurological conditions or neurological diseases. Example, stroke. So in stroke, what will be the common feature seen in the stroke? Hemiplegia. Okay, so assume that patient is a patient having right side hemiplegia. Okay, so right side hemiplegia. Anything ends with plegia means paralysis. Anything ends with plegia means paralysis. So hemiplegia means one side. So one side, both upper limb and then lower limb is being paralyzed. Okay, so for that we are going to give treatment called passive movement. So any kind of treatment there should be a separate principles, separate indication, separate contraindication and procedure technique. Okay, so for passive movement what are the principles will be there? What are the principles will be there? So relaxation of the patient, then so it's otherwise we term as a positioning, then fixation. So fixation means fixing the joint or fixing the joint which is we going to do movement. Okay, so for example if we going to give movement for shoulder means apart from the shoulder, elbow, wrist and other joints should be fixed point so that the movement will occur only in the shoulder joint. Understand? So relaxation, fixation, support, traction, then range of motion, then speed and rhythm. Okay, so first என்ன பண்றோம் relaxation position வெச்சு விடுறோம் patient, then we are fixing the other joints, then giving a mild traction, then applying a passive movement to full range and also consider the speed and rhythm. So you should not do like the full speed or you should not do like the slower speed. We will do the rhythmical movement. Okay, so in this we have to follow each and every principles. Okay, so in that I am going to teach you about shoulder movement. So for that I made the patient in a relaxed position, then I just adjusted the pillow so that we will get full range, otherwise the pillow will restrict the movement or restrict the range. Okay, then I applied the principle fixation, then I gave mild traction, then I gave a range of movement and then in a speed and rhythm. So durational intensity should be 30 repetitions. You have to give 30 repetitions of shoulder movement. So this is for shoulder flexion and extension. So after that we will give for shoulder abduction and adduction. So in this shoulder abduction and adduction we can give in two ways. One is a short lever passive movement. Other one is a long lever passive movement. So in acute condition, the patient was hospitalized. At that time, the shoulder, what will be present in the shoulder? Due to lack of movement or due to no movement, the shoulder will be in a not stiffness. It will be in a lax position or atrophy. What is atrophy? Muscle weakness. Due to no movement, muscle will become atrophy or weaken. So if we give a abduction in full range means, so shoulder joint is more stability or more mobility? More stability because of the less musculature. Sorry, more mobility. So there will be a full movement. So it's a less stability, right? Only more mobility. So there is no less stability or decreased stability. So if we give passive movement suddenly abduction action in long lever means what will happen to the head of humerus? It will come away from the linear fossa or linear labrum. So it will lead to the subluxation, which is a partial dislocation or complete dislocation of the shoulder joint. So as a therapist we have to consider everything about the patient. Okay, so initially we will go with short lever shoulder abduction and adduction, Then we can give in long leg, shoulder abduction adduction. Okay. So like that we have to give passive movement for each joints. Okay. So any doubt? So in upcoming classes we will see about each joint passive movements. Okay. Thank you.